My name's Daniel Ray. I'm Director of Informatics here at University Hospital Birmingham. And today I'm going to talk to you on the second mainstream video diary about something that we've created here to enable patients to access their information over the internet. I'm pleased to say that following a pilot that we've done in liver medicine, which is now coming to an end, the Trust is just finalising proposals and looking at rolling this out to wider other specialties within the Trust, all long-term conditions such as diabetes, bronchiectasis, endocrinology, rare diseases, and other chronic long-term conditions. So what I'm going to do now is just give you a run through of what the portal looks like at the moment. This is for a test patient, so obviously there's no issues whatsoever with confidentiality. So I'm just going to log in. Here we are. So as I say, this is purely fictional data, but I just wanted to give you a feel for the portal that's been developed. So on the left hand side, the user's able to see their support network that they've got. So this is other patients that they've got in contact with. They're presented with their recent activity. In the top right hand corner there's a calendar entry, so they've got what upcoming appointments they've got. So they can click on your records, communicate, help and your favourites. So we're keeping the navigation of this nice and simple. So under your records we've got medication, so that's where they can view their current medication, medication that they've been on in this hospital whilst as an inpatient that we pull from our e-prescribing solution, PICS. There's lab results, so that's where they're able to view their historical lab results or indeed upload lab results. If they have blood tests done locally with their GP, they can upload external blood results, and on the back of this we can hang rules to notify certain people within the organisation. There's inpatient history where they can view their historical admissions. There's the diagnosis, which details comorbidities and links to various websites specific to their disease. There's their calendar, where if we just go to this one perhaps, they can view what their upcoming appointments are. They can enter in appointments themselves, they can add an event, or they can view what's happened historically to them. Under your contacts, they can detail the contacts of their GP, their local centre, their tertiary centre. There's something called Your Vault that's been created, which enables the patient to upload files that are relevant to their care that they may only have paper copies of. There's something called Your Profile, where they're able to edit their contact details and their networking. Under Communicate, they can access their letters that are scanned in. So if we just open this up, here we are. So you can see the GP referral, the clinic letter, outpatient performers, etc., which they can access and view online, that have been scanned in, and it renders in a PDF format when you go to view it. There are conversations, so they can start a conversation with themselves and a group, so other patients that they've given consent to communicate with, or their consultant or the clinical teams in the Trust. There's a biog, so they can write about how they're feeling when, which enables them to recall this information when they're feeling certain elements of pain at certain points or times of the day. They can record this and communicate it to their consultant. There's help, where they can contact MyHealth or look at the release history of the website. And there's their favourites, which they can just click on here. So it's really important to stress and emphasise that this has been built with patients, for patients, by patients.